The way we think about it is, first of all, we have to commit to being part of the solution. And I think all hospital health systems in this country can be part of the solution. I think physicians can be part of it, and all the other participants in delivering healthcare in this country can be part of it. For us, we know that we have to get our costs to a level where we have choices to make about how we can help reduce the cost of care to the people that we serve. And we have costs that are directly lined up with delivering health care. We have other costs that maybe have crept into the system, and I'm sure most health systems are the same way. And so job one is getting your own costs down. I think job two is then using that choice that you have now created for yourself to identify ways that can be most impactful for the people that we serve. And that's where it gets a little more difficult, because oftentimes you're dealing with an insurance company as an intermediary between you and the patient, and sometimes your attempts to lower cost and produce more patient benefit don't translate through others that are involved in the system. So a lot of work to do. The Baylor Scott White Quality Alliance is one of our primary structures to align physicians and our own hospitals and ACO participant hospitals in looking at the cost of care, looking at ways that we can work with payers to reduce costs. And I've just been very gratified by how the governance of the Quality Alliance, which is mostly physicians, have really stepped up to the task of reducing costs and looking at practice variation that is oftentimes what's driving most of the cost. And them talking to one another about how they treat certain things is an important first step in the process. Yeah, there's some evidence that medical schools around the country are beginning to teach some different approaches to more conservative diagnosis and treatment of patients, but it probably isn't moving as quickly as it needs to. So I think it falls on those of us who are involved in graduate medical education to help guide physicians in training to a more conservative approach to the care that they provide, and we're trying to do that. And I think the physicians who lead parts of our residency programs, I think, are very aware of the need to introduce some new topics and concepts into how physicians are being asked to practice these days.